So what we're going to talk about, basically, I know right now it's kind of interesting times because of COVID and inability to actually get together with your loved ones for the holidays. But in general, I'm going to talk about the holiday tips, but also how to deal with agitation and difficulties as they come up. And as Adam said, I'm a medical director at AltaVita campus. I'm a geriatric psychiatrist. I've been doing this for 24 years. And please, if you have any questions, you guys can type in the chat form, or at the end we can talk about it. So I kind of, when I was thinking about this, I had to come up with some slides. I was talking to myself about, you know, it is like during the holidays, it's very chaotic. And how would you navigate through the chaos during the holidays, especially? And usually you want to think ahead, plan 2 to 3 weeks ahead. And what makes sense is, especially during the holidays, since people only see their loved ones once every few months, it makes sense to kind of warn them about their new behavior of your loved ones. So either being like a video chat or calling or writing a note to the family regarding the person changing in behaviors, and you know, such as like warning them that they may not follow social norms anymore. They may chew loudly with their mouth open, they can pass gas, they can talk loudly, they interrupt others, they walk away in the middle of conversation. And setting up the expectation of the new normal, that's kind of what I would recommend to say this is the new person with dementia, that they're not the same person as they used to be. And one of the other things that I was thinking about when I was coming up with these slides was the decorating safety tips, avoiding candles or any fire source such as matches or fireplaces, using LED lights instead of candles or electric ones that can get hot. The LED lights stay cool to touch. Avoiding fake edible decorations like fruits or veggies, avoiding flashing lights or loud noisemakers, keeping decoration clutter to a minimum. And as you see in this theme is preventing falls and preventing fires. So keeping decoration clutter to a minimum to prevent falls, no decorative area rugs to prevent falls, throwing boxes away immediately and maintaining a clear pathway to prevent falls. So fall becomes quite a safety issue during the holidays because when you're rearranging the furniture, people aren't used to the new setup, and you know, they may hold on to furniture, and again, that increases risk of falls. Holiday party tips, you know, pick a time that is that's best fitting for their dementia schedule. Most of patients with dementia have a time of a day that they're at their best. So usually in the morning, they're the best as they are. So holiday brunch rather than a dinner to avoid sundowning. Giving yourself to permission to leave early. That if the person is starting to get agitated or they're sundowning as it becomes more late afternoon, evening time, give yourself permission to excuse yourself and leave. Or if it's just too much for you and you just can't imagine taking this person with you, ask someone to stay with them so you can go and enjoy yourself on your own for a few hours. Keeping things simple, but including the dementia person in the activities, such as, even if it's just like washing vegetables, setting up the table, rolling out cookies, something simple that they kind of still feel like that they're part of the family, but it's not complicated. This one I always get questioned about how much alcohol is too much. And I usually, the rule of thumb is that one of the problems is that a lot of these patients are on other medications, and it can interact with other medications, and it can increase the potency of other medications. It can cause falls. And the main thing with dementia and alcohol is that you don't want to take away any social inhibition away from someone who already has very few inhibition left. So with alcohol, you kind of get disinhibited, the frontal lobe is not working. So with dementia patients, their frontal lobes is already not working. So if you add alcohol to that, it takes away from their inhibition. And if it's really a holiday ritual, then water it down or use non-alcoholic beer or wine. Use mocktail recipes. Basically, you're just trying to trick them into the fact that you're still drinking, you're still part of the ritual, but the alcohol is not there. And so, and again, the problem is, like I said, right now, because of COVID, there's not going to be a lot of parties around. But what I thought I would focus on for the next 30, 40 minutes would be to go through the fact about how to deal with behaviors, even if it is a party or if it's not the party, how you would approach them, because you may fail and they may get agitated, but now what? How are you going to handle it? And the person with dementia is not their diagnosis. Like I usually try to tell families, because families are always like, well, this is not my mom. She would never do that, or he would never curse. He would never hit anyone. And you have to realize that fact that this is not the same person. This is your parent or your loved one with dementia. And like my dad has dementia. I always talk about him in these talks, and I would have never thought of some of the things he does now that he would have never ever done in the past. Like the caregivers are telling me that he's a good dancer and he's always wanting to dance, and I'm like, huh? My dad never used to want to be to dance to any music, but now that he doesn't have his frontal lobe and he's disinhibited, he likes to dance, and he actually always wants to drink a beer for whatever reason, and he never used to do that either. So, and the following suggestions are to help you navigate through the chaos, be it at the holidays or not, because these problems are existing even after the holidays are gone. So 3 most important things that I want you to take away from today is that understand the feelings that our loved ones have inside. The feeling lasts longer than the memory of what caused them. So if you yell at them because they wet themselves, and they're not going to remember 30 minutes later that you yelled at them, but they're going to have that feeling of shame and feeling of guilt of, what did I do? I must have done something wrong because I don't feel good. Like somebody yelled at me. And they may not remember that they got yelled at, but they will remember that not feeling good about themselves. So again, the feeling will last longer than the memory of what caused that feeling. And understanding that their world is really guided by their gut instinct. So be genuine in your interactions. And listening with your heart to understand the feelings, wishes, likes, dislikes, and needs of your loved one. That's also very important. And you know them the best, of what they like, what they don't like, but sometimes even those things have changed during their dementia illness. And always, so I'm going to have several slides that start with always, and then we'll have some that says never. So, but always be aware of your energy, because your mood, your body language, your tone, they look to you for cues of how to react to a certain situation or how to behave. They may not understand the words, but they understand the tone that you're using. Kind of like if you have a toddler or a child and you're angry, they pick up on your mood, they pick up on your anger, and they start crying. So it's kind of the same level as that. And when you walk in from your day at work, or when you're together 24/7, and if you kind of feel that negative energy rising, go to another room, go for a walk outside. Don't stay in the room with the person with that negative energy. And again, this is another, always be aware of the energy in your house, because both frenetic and calm are contagious. So if you're kind of feeling up, but the other person is like in the evening, they're kind of going, what's going on? Do I need to be up right now, or do I need to be calm? So you have to kind of check in with your energy, because they mirror our energy.
Dr. Long?
Yeah.
So quick question for you. You didn't include it in on your slides, which you normally do. But you were talking about the like the child, the age range. Can you, I think it would be really helpful. Can you touch on that as far as the brain scans? Because I know you always use it, and it makes such perfect sense.
Right. So yeah, that's a good point. So what I mean by, I don't mean that your loved one becomes a child, but the brain looks like a child. And there is, and I can show you at the end of the slides, if you remind me, I will pull up that other slide. So they've done studies of functional MRIs, functional brain MRIs. And at the beginning of the dementia, like at the level of mild cognitive impairment, people start having some problems with their parietal lobes, which is the back of the brain. And as the disease progresses, they start having problems with their frontal lobes. And our frontal lobes are what I call emotional brake. So if my frontal lobe is not working and I'm angry and I want to slap Adam, my frontal lobe hopefully is working, says, no, use your words, don't slap him. You don't need to get angry. But if I don't have my frontal lobe and I'm disinhibited, which is what I was talking about, the alcohol making you disinhibited, I may act on my instinct of slapping someone instead of using my words. And then as it progresses, the brain starts to look like a 5-year-old brain. So instead of, them having a full brain that you started with, your brain looks like a child, which at that point, like I was saying, it doesn't mean your person is a child, but it means that their brain starts to act like a child. So they have tantrums, they say no, they don't want to take showers, sometimes they don't want to eat. So it is a function of the brain. And if you remind me, I will pull up that slide at the end of the talk, and I'll show them to you guys. And so again, the energy, they mirror it. and always respect them and their life experiences, their life accomplishment. You know, they have led incredible lives. They're not children, obviously, but their brain looks like a child. And that's why they have some of the behaviors of a child. And treating each and every person with kindness all the time, no matter what they say or do or how many times they've asked or said or done something. I know my mom was having really hard time with my dad, as he always asked the same question of, has the mail come? That was his thing, that he always wanted to check the mail. And then of course, you know, he's doing this 200 times a day, and my mom would get mad and just be like, I already checked it and I already brought it in. And then, so I told mom, I was like, Mom, but don't get mad. He doesn't remember. So just say, I'll check. And then, you know, of course, 30 minutes later, it was the same thing. Has the mail come? And when my mom started saying, I'll check, instead of yelling at him, you know, things got, it got blown off and it wasn't an issue anymore. But I know it's very frustrating because it's, especially for 24/7 caregivers, because it is, it becomes very trying when they keep asking the same question or they do the same things. Always allow them to have the freedom to be themselves and accept them as they are. I love this one because, you know, we put pressure on them to perform. And when this pressure is taken off of them by not asking them the questions or expecting them too much, they kind of feel more at ease, and you set them up for to succeed. One example is, like, I'll never forget it. There was a family member who would come and visit at AltaVita, and they were always asking their loved one, do you remember? You remember this? Do you remember that? Do you remember you have a grandchild now? Do you remember? And this person would get so anxious. And then after they left, she would be very agitated because no, she does not remember that she had a new grandchild, and she does not remember that so-and-so moved out of state. So for her, it was so hard to keep it together and basically perform for these family members that would show up. And then after they left, she would blow up and she would be agitated because she had to, quote unquote, perform for them. So, you know, don't ask them, do you remember this? Do you remember that? You just kind of have open-ended questions of, well, tell me about your grandkids. Do you have any grandkids? Or, oh, look at these pictures. Let's look through these pictures of your grandkid, instead of asking them if they remember or not. And then in the next few ones, I'm going to say try to, because I know sometimes it's really hard to understand what they're going through and to understand why they're acting the way they do. But I always say, you know, try to step in their shoes and just kind of see how you would feel like if that was you. There was actually a really great book written by, there was a nurse named Virginia Bell who took care of dementia patients all of her life. And she unfortunately started experiencing her own dementia illness. And as she was going through these episodes, she decided to write a book about her experience. It's called Best Friend's Approach. And so she writes about the fact that how scary it was every morning to wake up and not know where she was, who these people were, because she was in an assisted living when she started writing the book, and who these people are, what am I doing here, to kind of just like ground herself every day. She said it was one of the scariest things in her life. And knowing that she was losing it was the other scary thing. Not realizing that what she was going through and where she was going to end up. So again, I say try to, because I know it's really hard to do that. And trying to stop an incident from escalating and getting out of control by stopping it before it starts. So if, like with my dad, for example, in the evenings, he would start kind of going around the house saying that he wanted to go home, and you knew that that was not going to end up well and he was going to get agitated. So usually we would start like with a favorite show that he liked, America Got Talent. So we had the YouTube channel of him watching that over and over, and he didn't remember this, you know, different episodes anyway. So we would put that, we give him food and kind of distract him from, because we knew at what time he would start to escalate with his behaviors and where we were going to end up with the agitated behaviors. So if you start kind of getting familiar with what's bugging them or what's going to start getting their agitation up and distracting them with food, music, or pictures. And try to have a list of things. And this one is really good for, like, if you're going to visit family members, if you're going out of town, or if you're going to travel via airplane, have a list of things that calms them down, because then you have a running list in your head and for other people to kind of have an idea of what helps these people calm down. So finding a quiet place in a different room, if we had a party, using headphones to listen to music, having pictures available, pictures that they like from their childhood, their children, their grandchildren, offering food, drink, ice cream, chocolate, whatever works to get them off the thought of being agitated. And then try to look out for yourself too, because again, when you start getting more and more frustrated and you start getting more and more agitated, they mirror your energy. And so you need to kind of step back and say, you know what, I need a break. I need to go for a timeout myself. You know, sometimes I even use that as, you know, when my mom was having a hard time, I would just tell her, you know, just leave the TV on America Got Talent. You go to the other room, listen to your meditation, do some breathing, because it was hard for her to kind of stay in that moment and not get agitated along with him. So you need to step back when you kind of feel yourself getting more agitated. And sometimes, like when you're going to a party, or if you're going to go out of town to visit family members, it's important to have like maybe somebody, like a designated person, somebody else besides just yourself, to have your back. So when you need help, you can just be like, hello, I need help. And these are the next few ones. Like I said, I have the always, and then I have tried to, and then I have never slides. So never, ever, never scold them, so verbally or physically. Never argue with them or try to rationalize with them. Never disagree with them. Never lose your temper or shout at them. So, and I know that these are all hard, and I know that I've lost it with my dad a couple of times, because we're all human, but these are kind of couple of things that you need to remember what not to do. And this one, disagreeing with someone, one time I had a couple, it was a husband and a wife, and the wife always wanted to go get her kids because she thought they had children still, and the husband would always argue that your kids are grown, there's nobody that you need to take care of. And so then she would get mad, and then he would get mad, and they would end up in argument every night almost. So I told him, I was like, don't argue with her, don't disagree with her, just say, oh my gosh, you're right, okay, we're gonna go get them. And then the next time they came to visit me, he was cute. He said, you know, that was the best advice I've ever had, and I've lived 75 years. So that was just something simple for them to start working on, not to disagree with them. Or we had one resident at AltaVita that always, like around evening time, she always wanted her car removed from a parking lot because she said if you park overnight, they charge more. So I would just say, okay, fine, I'm going to move your car. And she was the cutest thing because she would say, okay, well, you can keep the keys because I'm going to bed. You don't have to wake me up after you come back. And that was it. But we will go through the same thing every night. Every night she wanted to move her car. And then never humiliate them or shame them, especially when they're incontinent or have an accident, because like I said a few slides ago, that feeling of humiliation and being upset lasts a lot longer with them than what we do in general. And then disrespecting them, talking down to them, or treating them like a child. Don't ever do that. Never make them do something they don't want to do. And I know showering is a huge one. They usually don't want to shower, and you can't like pick them up and pull them in there because they're just going to get agitated, angry. So there's some ways of dealing with that, which we can talk about in a minute, but don't ever make them do something that they don't want to do, because you're both going to get agitated. Somebody's going to get hurt. And don't get into a power struggle with them. You will not win and you will lose their trust. Power struggle is not good for anyone. And knowing how to help, you know, knowing that how to talk to them, what to tell them, what their triggers are. Do they need hugs? Do they have a good sense of humor? What is their dominant personality? And you know them the best, but also, like I said before, a lot of times things change along the way. So you just have to adjust as you go on with their dementia. And listening fully and with your whole heart, you know, using strong eye contact and comforting body language. So a lot of times if you make eye contact with people, they are better able to pay attention to you. And if you don't have, like you don't have your arms crossed and you kind of look more relaxed, they also mirror that body language, and they are better able to be relaxed with you. And then when you are unsure of how to respond, just repeat what they say and just agree. So like when my dad would say that he needs to go to work, and there was no arguing with him because he really needed to go to work because that's what he thought he had to do. So I would just say, oh my gosh, oh, you want to go to work? Okay, I get it. You want to go to work? Okay. And just kind of go with the flow and be in that moment with them instead of arguing with them. Or like that woman that would say she had to go get her kids. The husband started saying, oh, getting the kids, that's what we need to do, instead of arguing with them. And then, of course, you know, this is very individualized. So some people are very lovey-dovey, they like to touch. Some people don't. So you know your person the best. So you need to kind of gauge that, is this person, do they want hugs, or do they just want like an arm around their shoulder, or do they want to hold hands? And there was a study actually that said people that are in long-term care facilities, the only time that they get touched by another human being is when we're doing something to them, like changing their diapers or changing their clothes or showering them. So it's usually something unpleasant that they don't want to do. So there's been a couple of studies showing that in the evenings, like during sundowning, you can do some lavender lotion and just holding their hand and just massaging their hand. You don't even have to like massage their shoulder or whatever. It's just that touch of touching their hand, holding their hand, massaging it with some good lavender oil or lavender massage lotion helps comfort them. And reminiscing, you know, with my dad, it was always like talking about his time in the refinery and his travels, and, you know, knowing what to talk to him about, and allowing the emotions and go with it. So if this person is really sad and they want to cry, let them cry. Don't say, oh no, don't cry, it's okay. It's okay to cry. And then of course, if they're laughing at something and they're having fun doing that too, or if they want to dance, dance with them. If they want to sing, sing with them. So allowing the emotion and going with it. And then redirecting sometimes can be very helpful if they're like really agitated and they're gung-ho about wanting to leave. You know, you can walk with them, change the subject, ask as few questions as possible. Don't keep asking them, what's wrong? What are you doing? Why are you doing this? Don't ask them those questions. Just ask few questions as possible. And if the best thing to do is like distracting them, if again, I always love food because most people can get distracted with food, drinks, chocolate, ice cream, but also we all as humans, we all want to be feeling needed, right? So feeling needed is very empowering. So even if it is like rolling cookies or setting up the table, or like I said, washing vegetables, something that they can kind of feel like that they're contributing to the situation.
Dr. Long, why would sweets be a good redirectional tool for somebody with dementia?
So good question. I think Adam has been listening to my talks in the past. So the reason that people love sweet as they get older is that as you get older, you lose most of the sensory points on your tongue, except the sweet part. So, and then with dementia, another double whammy is that you cannot smell, you lose a sense of smell. So here's someone who can't smell, they can't taste salt, they can't taste spicy foods, but they can taste sweets. And they enjoy the sweets most of anything else that they're eating. So, and I know, like my dad has diabetes too, and he gets really upset when you give him sherbet while you're giving an ice cream cone to somebody else. And I have come to my senses of saying, you know what, he wants ice cream, give him ice cream. He doesn't have to have a diabetic sherbet. We'll just deal with it later, because it's not worth making him upset over something that is so easily fixed. And so that is the reason that a lot of older patients with dementia love sweets, because you lose most of the senses of your tongue except tip of your tongue, which has to do with sweetness, and you can't smell. So when you can't smell like spicy foods or cinnamon, it just doesn't have the same pleasure as ice cream would. Okay, and then working as a team, like I told you before, please accept help, you know, and ask for help. And I know right now it's so hard with COVID because everybody's very isolated, but a new face can be amazingly helpful. So if you can get like few hours of a caregiver to come in and help you, or a family member come in and help you in the evenings or mornings, so it gives you a break. So working as a team is very helpful. And this one I already talked a little about, like have an assigned person to check in on them periodically, like if you're at a party. I usually have my little nieces, pretty cute and loves my dad. So we usually have my little niece to kind of, if there's a party, that she sits next to him, or they sit through and look through a book. So have someone to check in with them periodically to just kind of make sure where you're at. Are they getting agitated? Are they getting overwhelmed? And when in doubt, sing. Singing is so amazing in any language, in any culture. Music is always healing. And I can't tell you how many times we break out into singing at AltaVita or at my own house. Usually my go-to song is, you know, with happy songs. It can be just kindergarten songs, anything that they remember. And it's amazing, some people can't even talk, but then when you start singing, they can say all the lyrics of the songs that they remember from the past. And you know, I use a phrase therapeutic lying, because I know families kind of feel weird about lying to their loved ones, especially some of the spouses are like, I have never lied to my wife or my husband, and I'm not going to start now after 42 years. And I'm like, well, okay, you can do that, but nobody's going to be happy at the end of the day. And I call these therapeutic lies because it's therapeutic for them, therefore it's therapeutic for you. Like when I would tell the lady that I'm going to go move her car, it was comforting for her because she thought, oh, here's someone who cares and is going to go move my car, so I don't have to worry about it all night. So yes, that was a lie, but it was calming. And then we went through that almost every day. So I don't consider it quite lying, except that it is therapeutic lying. And really know them, because you can give them some answers, but you need to be ready that it makes sense to them. Like I made a mistake of telling my dad one time that my mom had gone shopping, and my dad knew that my mom hates shopping. So he just like gave me a weird look of like, why would your mom go shopping? She never goes to the mall. And which at that point I was like, oh yeah, you're right. She went to get her hair cut, which she did quite often, or her hair colored. So you got to give them some answers that it makes sense to them. They're not going to take just any answer. And again, like lie about day-to-day stuff, not about their family history or their history or family. You know, one thing is we had, I mean, I've had several times, unfortunately, that one spouse dies and the other spouse doesn't understand that they're dead, and they're asking for their spouse. And sometimes when we would tell this person that Jack is dead, she would just lose it, and she would cry, 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 and it was a daily event. So we came to the point of asking the family permission too, but we came to the point of Jack is at work, because Jack used to travel for work. He was a researcher. So instead of saying Jack is not with us any longer, we would say Jack is on a work trip. He's doing a research trip. And that made sense to her, and it was fine. Then she didn't go through this grieving process every day. It was easier for her to just say, oh, he's at work, he's coming back later. And it just kind of left it at that. And this, I think, is my last slide. So know in your heart that if you allow them to be in the moment and make that moment joyful and safe, that life is good. And again, I'm going to emphasize this emotional response lasts far longer than the memory of eliciting that emotion. So when I go visit my dad, he totally does not remember it even 10 minutes later. But they say he's happy for like 24, 48 hours after the visit. Even though he doesn't remember the visit, but he remembers that feeling that it made him feel in that moment of he was happy about seeing me, he was happy about seeing us. So it made him happy to do that. And again, it is a, you know, like I said at one point, it is a double-edged sword, because with dementia, it does rob them from their memory. But one nice thing is that they can live in the moment, and it doesn't have to be a sad disease. It can be a happy moment, and that joyful moment. And I have just several pictures of a couple of my favorite patients. And what I wanted to show you, that this is no, not a face of a sad disease, you know, that people can be happy in the moment, living in the moment. There's a couple of my favorites, but I think that's my last slide. Yes. So what I want you to take away, which I'll go back and see if I can find that slide. But
so Dr. Long, one of our people who have joined us tonight, we're talking about when you're telling a therapeutic lie, you're not really lying, right? Because you're joining them in their reality.
Reality, yes.
Yeah, and so I found that really interesting, because we do talk a lot about people with dementia don't necessarily live in our reality; they have their own reality, right. And we need to join them in their reality. And one of the best things that I've ever heard was, and I think you might have shared this with me before too. I don't know if it was you or not, but if your mom is saying, I want to go on a trip and I'm waiting in the airport to get on the plane, you don't necessarily tell them, well, you're not in the airport and we're not going on a trip. You know, you kind of just sit with them and say, okay, well, we're waiting for the plane. And you sit with them, and then you start to slowly redirect them in a different, in a different way.
Right, right. Very true. And we had this lady actually at AltaVita that she always thought she was on a cruise, which I'm like, I hope I'm one of those demented people that thinks I'm always on a cruise. Because she would say she always waited by the door after the activities or meals, and you ask her, what are you doing? She said, oh, my daughter is coming to pick me up from the port. So she thought she was on a port, And the reason she thought she was on a cruise was because she said this place is amazing. It has meals at all times and activities at all times. And I was like, that's awesome. If you think you're on a cruise, why would you want to correct that? In this one, as I promised, to show you the picture of the slides. This is a PET scan. So this first brain is a healthy brain. So hopefully most of us have this brain. So you want a lot of red. Red means blood flow. The second one is what we call MCI, which is mild cognitive impairment. And this is the back of the brain. As you see, it has less red on the back of the brain. This one is a severe demented patient. And as you can see, unfortunately, not just the back, the frontal lobes are affected too. So this is the front, this is the back of the brain. So less red means less brain working. And this is a 5-year-old brain. So as you can see, and like I said, I'm not saying they become children, but their brain becomes like a child. And our frontal lobes, this is the part of the brain that has to do with our emotional breaks and decision-making, judgment. So as this part of the brain gets shrunk and atrophies, you're going to have difficulty making decisions, you're going to have tantrums, you're going to have agitation. You may say things that you wouldn't say before. You may do things that you wouldn't do before. So that's kind of like, which I'm glad Adam reminded me of the slide, because that kind of puts it out very visually interesting way of looking at the brain.
I think that's like should be in all of your talks.
Okay. Good idea.
We did have somebody who asked, please provide us with some strategies to get our loved ones to do things they don't want to do.
So a couple of things. One thing is, as you notice right here with the frontal lobe, and when your child was 3 or 5 years old, they didn't want to take showers either. And you have to kind of trick them into doing things, and you don't explain it explicitly. Like with my dad never wanted to take a shower, and my mom would argue with him all day that you're going to take a shower tonight, you're going to take a shower tonight. And then of course he'd be like, nope, I'm not taking a shower tonight. And I told mom, I was like, Mom, just stop saying that you're going to take a shower tonight. And he's going to say no. So I would actually show up and just pick up towels and a shampoo and show it to him. And he would say, what's that for? And I would just say, oh, well, come on with me, I'll show you. And then by the time he made it to the shower, then he was kind of mad at me. But then when we started taking his shirt off, then he would just kind of go by himself and take, I mean, you had to stand in there with him because he couldn't do it all by himself. But visual cues are really important. And kind of getting them to make it their idea rather than your idea, it's important. Some of the things like with safety issues, if they, like driving is an example, it's a safety issue, and I know nobody wants to stop driving, but hey, if they're putting themselves or other people in danger, at some point, I mean, you may want to have to disable their car, like take the battery out, instead of just saying you can't drive, because that makes them upset every time. And then another way to look at it too, sometimes when people are depressed or anxious, they're more likely to not want to do things, and they're more likely to be agitated. So, you know, you could be considering that, is this person agitated because they're anxious or depressed? which in that case, medications are helpful. You know, we have so many good medications for anxiety and depression that sometimes you need to use medications to help you with agitation or decreasing agitation.
Another good one, Dr. Long, too, with doing smaller things, like if they're having trouble with getting them changed or getting them undressed, is you know, into like pajamas, or in the morning into, you know, the clothes for the day, and they've worn the same clothes. You know, is talking about, oh, look, there's a stain on that shirt. How about we get this off and I get it washed for you, and then get them into something new. So like Dr. Long was talking about, with coming up with those ideas of it's their idea and convincing them it was their idea. Little things like that go a long way.
Right. And you know, another thing too is that as the disease progresses, people have what we call aphasia, which is the comprehension aphasia, which is they don't understand language as well. So it may be that you're telling them, come on, let's go take a shower, but they don't kind of understand at all what you're trying to tell them. And then when you try to force them, then it's not their idea. And then of course they're going to get agitated because why are you pulling me in that direction? So aphasia can be really difficult too with and sometimes it can be expressive aphasia, which is they forget how to talk or how to express themselves. So either one of those comprehensive and expressive aphasia can be source of agitation and refusing to do things because they don't understand.
And I think, I know we're getting close on time here, and I know everybody has been taking all of this stuff in, and it's a lot to remember. We will have this video cut and put together so we can put it on our website so you guys can review it later and share it with friends and family. But I think one of the more important things to talk about too, Dr. Long, with holidays and dementia specifically, is that approach, that proper approach, and to share with family members of what that kind of looks like due to the decreased visual range and everything like that. So can you talk a little bit about what a proper approach for somebody with dementia would be, just to let other family members know?
Like as far as their new behaviors, or?
Well, just like if somebody were to walk up to them and start interacting with them, how to make it most comfortable for that individual.
Right. Yeah. And like I said, don't put them on the spot. So, you know, sometimes these people, they haven't seen them for months or years and they may not remember. And people get their feelings hurt, which is quite amazing. I've had my family members do that, oh my gosh, your dad doesn't remember me. And I'm like, yeah, he's demented. Of course he doesn't remember you. But they get their feelings hurt. And then they start asking questions of, what, you don't remember me? Remember we did this, we did that. Remember I'm your brother's son. And so don't ask questions like that. And then also, if like I said before, if you are going to get into like a large crowd or be around other people, make sure that you have the loved one, like the demented patient, somewhere more quiet, and you can be there when other people approach them, and warning them that, you know, beforehand, like with the video chat or email, writing a note to the fact that this is the new normal. This person may not recognize you. Please don't keep questioning them about who you are or who they are, and just kind of let it go. But yes, approach is very important. And like I said, they mirror your energy. So if you're getting upset because this person doesn't remember you, they're definitely getting upset because they're like, oh, I really upset this person by not knowing their name, so I don't know what's going to happen next.
Hey, Dr. Long, this is Lindsay. There was someone that asked what the book was, the name of the book that you were referencing.
Oh,
I think you said by Virginia Bell.
Virginia Bell, Best Friends Approach.
And there's
Thank
another
you, Dr.
question.
Long.
There's another question that came in. Should we have family members be placed directly in front of them? Isn't their peripheral vision different?
Well, it all depends on the person, because some people do have glaucoma. Some people can't only see shapes, so it depends on the person. But don't ever approach them from the back. No, like, don't startle them. And when you are approaching them, make sure that they know you're getting closer, because don't startle them from the back. Don't come from the side. Usually come from the front if possible. And soft voice, you know, not a loud surprise voice.
And definitely, if they're seated, you know, not to approach them standing up like directly above them type situation, right, too.
Yeah, or from their back. Yes. Yeah.
Does anybody else have any questions for Dr. Long about the holidays, about dementia, and the best way to handle certain situations? And again, well, we will be posting this video so that way you guys can reference it later. And if you do want to have a copy of, like, a link to share with people for that, please send me an email. I will go ahead and post that in the chat box, and then you guys can always just send me an email requesting that, and I can send it out to you.
Well, thank you, everybody. And
thank you, Dr. Long.
We're on time, 5:34. So, well, 6:34, I guess your time. So thanks for participating. And as Adam said, if you have any questions, you can email it to him and he can forward it to me. And I'll be glad to answer anything.
All right. Well, thank you, Dr. Long, so much for your wisdom tonight. And to anybody else who might have any other questions or concerns, like she said, you can email me, and please keep an eye out for other educational videos that we will be posting coming up within the next several months as we continue to do Zoom webinars.
Good.
All right. Thank you, guys. Have a good night.
Thank you all for attending. Thanks, Dr. Long. Bye, Adam. Bye, Dr. Long.
Bye-bye.